Well, hi everybody. It's Dr. Paul Feuerstein, Editor-in-Chief of Dentistry today. And I have the extreme pleasure to be here with Dr. Khushbu Shah. And let's talk about you right away, because you're doing something that I don't do exactly. You're working in the public health sector.
Yes.
In the Chicago area. So tell us about your journey about public health and why you're doing that and how much you get out of that.
Yes, it's definitely a very rewarding experience. I've been in public health for 11 years. I work at a health center where we provide comprehensive care. So we have medical, dental, behavioral health, everything under one roof, which is really nice. And it's very rewarding for the patients, because a lot of the patients that I treat are low-income patients, or I work with a lot of immigrants and refugees, so they have nowhere else to go. So.
And what about children? Do you see a lot of young children too?
I see all ages, yeah.
Oh,
so I see a huge number of pediatric population, and all the way to geriatrics.
So you had an opportunity to take someone who's basically poor, to use for lack of a better word. They come in, they have chipped teeth, they have broken restoration, they have decay in different areas, and they walk out the door smiling.
Yes.
That has to be great.
It's very rewarding. And it makes you realize no matter which income scale you're on, everyone wants the beautiful smile, right?
Yeah.
So
luckily, we're here and we're able to talk about Tokuyama's product line, which is the OMNICHROMA line.
Yeah.
And when it first came out, it was like, what? I don't need a shade.
Yes.
It's all shade matching. So let's talk about the anterior teeth first. Someone comes in with a lot of chipped teeth, and so what's your go-to product in that case?
For the anterior teeth, there's more opacity. I always find myself reaching for the OMNICHROMA blocker. Yes, and then for the incisal ledge, I'll use regular OMNICHROMA. So it's great, but the best part about OMNICHROMA is all the way from aesthetics to polishability. I mean, it can really transform a smile.
That's great.
Yeah.
Now, they've come out with some new products also. They have a flowable, they have a bulk flow, and I know when you see children, sometimes they're not the easiest to work on.
Exactly.
So how does that work? How does that fit into your process?
I love using OMNICHROMA Flow on my uncooperative pediatric population. It's just very easy. When it's an uncooperative patient, time is of the essence. So the most important thing is I need it to be fast and I need it to work really well. So
and you get an aesthetic result too. I mean,
exactly.
The parent comes in and says, wow, there used to be a black hole here. And now it's a nice white tooth.
Exactly, and they're just amazed. They're like, which one did you do?
I mean, that's great stuff. I'm in a general practice myself. I don't see a lot of children, but when I do, I grab the flowable. And because the bulk flow has a little more substance to it, it's very easy to use because it doesn't just drop out of sight for me.
It's very easy. And one of the best patient cases that I had is I had a 10-year-old boy who was born and raised in Africa. So he had severe fluorosis. So brown pitted enamel, lots of different shades on his existing teeth. I used OMNICHROMA blocker because of the high opacity, and I did composite veneers on him, all 4 anteriors, and he was so amazed.
He must have walked out like,
he was like ready to start 4th grade. The best part was the dad walks in and he's like, oh my God, wow, this is amazing. Can you do this for my smile? Because I've had this problem my whole life, because fluorosis is high in other countries. So there's a lot of discoloration. And for OMNICHROMA to be able to transform his smile, I was amazed.
That's pretty great. So you sort of glanced over this thing called blocker.
Yes.
So I know the answer, but I'll have you explain your process. So if someone comes in with a 45-degree chip on their anterior tooth, if you just put the OMNICHROMA across that and bonded it on, it would be too translucent.
Right.
So tell us about the blocker a little bit, how that comes into play.
So I find myself, I always use a OMNICHROMA blocker first to build the wall, and then I will, because it creates that nice opacity background, and then I will use the OMNICHROMA regular.
So you're bonding it lingually first.
And then exactly.
And again, the color match is just, you can't talk about it. And I have to say, there are other companies that are sneaking up on this. They go, we're just as good as, and so
they've been around the longest.
It's nice to be the mark of the top mark, and everybody's comparing themselves to you. And I know I've talked to the developers here. They've constantly improved it a little bit more, little things that they do to it to make it even better. I mean, and like I said, all the different top versions that come out.
What I also love about OMNICHROMA is that this is one of the only composites that if they do bleaching, that I.
Oh, it doesn't matter.
Yes, because it will change when they do. So
Oh.
I have a lot of patients who will be bleaching at home
That's a big
bleaching,
deal.
and
Because I've had
it
patients who
transforms.
have regular restorations. They go, well, if I bleach my teeth, the restoration will be a different color. So, so
Exactly.
it changes underneath.
Exactly.
And it goes through. Oh, wow.
That's so
I never
unique.
thought of that.
Yeah.
That's a great idea. You know, and
Definitely.
it must be gratifying to see these people coming in with this and coming out like
Yes.
that.
Yes. I mean, that is one of the most rewarding parts of
Yeah.
my day-to-day work, is just seeing them smile after so many years. You know, they've been putting it off because they couldn't afford it or they didn't have dental insurance.
Sure.
And they walk in and they're like, I'm just so grateful to have somewhere to go to.
Well, you know what? First, I want to say thank you for doing what you're doing in the
Thank you.
whole world here. I think it's very
Yeah.
important. And a lot of people overlook this space. They go,
Yes.
you know, I want to do all fancy crowns and 3D printed stuff and all these kind of things. But this is you're the foundational. You're just doing it great. And thank you so much.
Thank you. Thank
So it's been
you.
a real
I really
pleasure.
very-
So I'm glad to see you.
Thank you so
Nice to have met
much.
you. And thank you very much.
Thank you. Thank you so much.